Assalamu alaikum warahmatullahi wabarakatuh. Today we shall be talking about seizure disorders, commonly known as epilepsy. We need to talk about epilepsy because of the stigmatization on this disease or this disorder in this environment. What is epilepsy? Seizure disorders are a form of recurrent occurrence or malformation in the cerebral function. The cerebrum, of course, being the brain, what we generally refer to as the brain. Sometimes the cause of these seizure disorders may be known, could be traced to perhaps a head injury, could be traced to a disease or the other, could be traced to trauma that the child suffered even during the time it was being born, birth trauma. But on most occasions, the cause may actually not be known. And yet, this child would convulse, and that's the most common form of seizure disorders. The child may convulse, and you see the child losing consciousness, and then the limbs are everywhere, sometimes even associated with loss of control of defecation, loss of control of urination, and all of that. And that is why it's a stigmatized disorder, in that most people do not want to be associated with somebody who could just fall at any time in any place and then have this seizure disorder. Like I said earlier, the cause may be known, the cause may not be known. In the event that a child has a febrile illness, even as simple as our people will say as malaria, and then goes into convulsions, the cause of this is well known. Once it is treated, the seizures disappear. But for those situations where the seizures recur and continue to recur, then we make a diagnosis of epilepsy or a seizure disorder. This is now different from just having a febrile convulsion. Now, what we need to know is how to deal with this kind of individuals. You see, sometimes when someone has seizures, the first thing that people look for is a knife or a ruler or something to put in the mouth. Some people even put their hands, their fingers inside this convulsing individual's mouth. These are things that we should avoid. Once someone is convulsing, allow the person be as he is, lying flat, because usually they will go into the flat position. Allow them to remain flat, but turn them onto the side so that they do not aspirate whatever the saliva, because most of them will foam and will produce excessive saliva anyway. So you turn them onto the side. If you must put anything in the mouth, then it's a ruler around which you have wrapped a towel or a napkin, not your finger, not a spoon, because in the process you may damage the tongue, you may damage the teeth, and they will then take this up, and this is actually what will make them choke and kill them. The convulsions themselves will not be the cause of death. It is what we do following the convulsion that may lead to death. You even see some people going to look for concoctions that they have made with cow urine and all sorts of things. These will not help the individual. Allow them lie flat, turn them to the left side, raise the head up with a pillow if available. Otherwise, leave them and then transport to the hospital for proper management. Do not put the child's leg into a fire. This has been done before. You find that, like I said, it's what people do with the convulsion that actually causes death or permanent injury, not the actual event of the convulsion. We need to learn more about seizure disorders. We need to learn more about epilepsy. We also need to support these individuals. Do not stigmatize them. Support them, let them live as close to a normal life as possible, and then get them adequate treatment. With proper management, they can live a very normal life, and we should be happy to associate with them. Assalamu alaikum wa rahmatullahi wa barakatuh.